Hi, I'm Dr. Serena Satcher, and I want to talk about an issue that I've had a couple of questions on over the past couple of weeks, or actually the past month. Several older women have asked me about how they should restrict their sodium because they're getting swelling in their lower legs during the day. And I suggested compression hose for all of them, like right on the spot, because they were not using compression hose. And the compression hose can really help to control the swelling during the day as the day goes on. And especially when people have problems with their veins in their legs, it can help to compress the veins where the blood may pool during the day as the day goes on and as the legs are in a dependent position or the person's either standing up or sitting down with their feet touching the ground for the majority of the day. So I just wanted to address this question from the functional medicine perspectives, because what I've learned over the years in functional medicine is that it's really leaky blood vessels that are causing the problem with the swelling in the lower legs. And the way to address this issue is to get those blood vessels, uh, get the membranes to be more intact and less leaky. And the way that can be done is by changing nutrition. Um, what happens is when people are eating a lot of inflammatory foods, then those blood vessels get leaky. Also, the blood-brain barrier can get leaky as well, and it will let fluids and sodium and other things flow across the membrane and cause swelling in the area or imbalances in the minerals. Another thing that contributes is that our food is very low in minerals, and this has happened over a number of years because the soil is not as nutrient dense as it used to be that they're growing the vegetables in. So a couple of things that can be done is eating an anti-inflammatory diet and eating, and you can look up online or look up on Google what an anti-inflammatory diet entails, but generally it's the Mediterranean diet while watching the inclusion of processed carbohydrates. And processed carbohydrates, you all have heard me talk about before, but processed carbohydrates will cause a depletion of minerals inside the cells. And we can boost up the amount of minerals that we're taking into our bodies by consuming a lot of fruits and vegetables that naturally contain minerals. And also, we can add minerals to our drinking water. Trace minerals can be obtained at places like the Vitamin Shop, I think GNC, pretty much anywhere. But if you check my website at treatyourself2health.com, and if you go to the store on my website, you can purchase liquid trace minerals, and you can use the liquid trace minerals to add to your water, your drinking water. You should be drinking plenty of water every day to help flush things out. You also want to avoid um, eating processed foods and ultra processed foods, which we know from studies, and this was reported in the New York Times just last month, that ultra processed foods can shorten our lives because they cause a lot of different diseases. So I hope that answered that question. And if you have more questions, hit me up on my social media on Instagram or on Facebook. And I'm at Treat Yourself to Health. And I'm Dr. Serena Satcher. Thanks for joining me for this little tip today.